I grew up in Northern Ireland in the 80s, technically part of the UK. And like most kids at that time, we were out playing with our friends in the streets in the evenings. And skateboards were the new big thing. And where we lived, at the end of our street, they'd built a brand new cul-de-sac, brand new houses, brand new flat bitumen surface. And it was quite a steep descent. So it was where we went in the evenings with our skateboards, and we'd walk up to the top of the hill, and we'd fly down that street, with the wind in our hair, feeling the exhilaration and the speed. Except at the age of 6, I wasn't really particularly proficient on my skateboard, and it felt safer for me to lie prone on my stomach, holding onto the rails of the skateboard and flying down the street only inches from the bitumen surface. And so on this unfortunate day, I hit a rock on the way down, got the wobbles, fell off, and scraped my face along the bitumen. And it was a real mess. You can imagine what it was like. There was blood pouring from my face. My teeth were chipped. I had scrapes and grazes all over my arms and legs. I carried my skateboard, and I walked home screaming and crying, looking for my mum and dad. I want you to imagine for a moment what you would do in that situation if that was your child. Blood pouring from their face, screaming, not knowing what to do. Where would you go for care? Where would you go for help? Who's going to help fix this situation for you? My mum, she hates the sight of blood, so she just gave me straight over to my dad. And my dad pulled a towel, went into action dad mode, pulled a towel out of the cupboard, bundled me into the back of the car, and had the towel there catching the blood dripping from my face as he drove me up the hill to the small country hospital in our town in Northern Ireland. And I remember walking into that hospital and up those steps very clearly, and what an austere environment it was. Bright fluoro lights, wide open spaces, lots of people and noise. Certainly not the sort of place you want to be as a 6-year-old when you're going to have your face reconstructed with stitches. And so they brought me into the procedure room, all white clinical bench tops, stainless steel trolleys, and there was no sedation back then, so the best they could do was give me a needle with some local anesthetic that didn't really work that well anyway. And I remember my dad bent over me with his weight, trying to pin me down, and me kicking and screaming, and the doctor shouting at me to be still while she came at me with these stainless steel instruments trying to fix my face. And so the whole experience was incredibly traumatic. And I still carry both the physical and the mental scars of that experience today. Fast forward now 40 years, and I'm the emergency physician. I'm the emergency specialist working in public emergency departments around Australia. I'm the most senior decision maker in an emergency department, and my job is to not only care for people, but to allocate the resources to the people that need it most, to manage the flow of patients, to manage the team of doctors and nurses, and to provide the greatest good for the greatest number. In our region here in New South Wales, Newcastle and the Hunter Valley, our population is about 500,000, and across the 4 hospitals in our region, 600 people turn up to emergency departments every day for care. That's a lot of people, and that's a lot of time, and that's a lot of resources that need to be provided. And when we talk about time, the median length of stay for people who attend our emergency departments in this region is over 5 hours. And did you know that 70%, actually more than 70% of the people that turn up to an emergency department get discharged home the same day? So 70% of people that go to an emergency department don't actually need hospital-level care. And so the question is, well, why are they there? And let's think about the resources that go into caring for those people. It's free, right? No, it's not free. It costs government hundreds of dollars to see and care for each of those people. In fact, the data from 2021, which is 3 years old now, suggests that it's nearly $800 on average for each person that goes to an emergency department. And when you're dealing with that type of volume and you're stretching the time and the resources that you have to care for those people, the care becomes fragmented. And when we talk to our nurses and our doctors working in this system, they're frustrated by the lack of ability to be able to provide compassionate care, to spend the time holding the hand and making the cup of tea, to spend the time explaining what the next steps are going to be and what's going on. And the other thing, when you talk to people in community about their experience, there was a long wait time, and when I actually finally got to see the doctor, I was so bamboozled. I felt like I was rushed. I lost my power, my autonomy as a person, my ability to advocate for myself. I was so bamboozled by all of the information. I left feeling confused. I'm not really sure what the next steps were. I mean, they said something about needing to organize a whole bunch of other tests and appointments and following up with my GP, and I know I'm not going to get an appointment with my GP for 3 weeks. So it creates this poor patient experience and fragmented care, and also it's really expensive and it takes ages. So, as an emergency physician, I have a unique insight into this, and it seems obvious to me that we need a better system. We need to be able to bring the emergency department out of hospital and into community. Emergency care in community. And when you look at what else is available in community, well, we have general practitioners, we have allied health and every other specialist. And GPs are amazing at doing their job. They care for people from birth through to death. They manage chronic disease. They screen people for disease. They practice preventative medicine. They'll make sure all of your medications are up to date, and they'll deal with any issues as they crop up along the way. But they're not set up for urgent same-day appointments when something unexpected occurs with an injury or illness. Locally, it's 3 weeks to get an appointment with a GP. And it's often difficult for them to perform the sort of procedures that need to occur when people have injuries. They may not have the equipment, they may not have the staffing mix, the resources, the skills. All of these things are a hindrance for GPs to be able to provide this type of emergency care. And so we needed something else. We needed a purpose-built walk-in facility where people can see an emergency team, an emergency expert team, straight away. And so we built that. We built that in community for community. And so we had to look at, well, what does that look like? Well, the footprint looks very much like an emergency department. So we have 14 treatment spaces, we have a resuscitation bay, we have a respiratory zone, we have an ear, nose, and throat room, we have a procedure room, we have x-ray facilities on site. You know, until we opened after lunchtime on a Saturday, you weren't able to get an x-ray in community without going to hospital. Now we have x-ray services in community available 365 days a year. We have these special blood gas machines that will analyze a drop of blood and give us a result in under 3 minutes. So we don't need a laboratory. We can actually make rapid decisions on people's care in record time. But it's not just about the bricks and mortar and the equipment that's in there. It's about the look and feel of the clinic. And if you're the 6-year-old that needs stitches in your face, you don't want that austere white clinical environment. And so we focused on the color on the walls, for example, the color of the lighting, the floor coverings, the furniture, the finishes. We used wood to soften the feel of the clinic. And so we do have 6-year-olds come into our clinic and even younger that need stitches in their face. And we bring them into our procedure room, which has a wraparound wall art mural with loads of detail so that they get distracted by looking at everything that's going on in the pictures. We can put the lights on dimmers, and we have TVs on the ceiling. And so when they need a procedure that's potentially painful, they're locked into the TV, and we actually put noise-canceling headphones on them so that they're genuinely locked into what's going on in Bluey or Peppa Pig. And that creates a great experience for that child, but also a great experience for the parent who's also super stressed. And so it's more than just the facility, it's the people in the facility that make all the difference. And so our team, we have a concierge team that meet and greet people when you walk in through the door. And while the clinic looks very much like a 5-star hotel, we wanted it to feel like a 5-star hotel. And so our people experience manager, who looks after the concierge team, he's a sommelier. Never worked in healthcare. Has worked in 5-star hotels and 5-star restaurants. Knows a lot about customer experience and knows a lot about how to make people feel special. And so when you walk in distress and you're anxious about what's going on and what the next steps are going to be, that team will greet you and settle you and get you calmed. Explain what the steps are. Bring refreshments. Look after the kids. Give them iPads. Give them coloring in. And they will follow you along your journey through the clinic and make sure that we meet your expectations. Hospitality in healthcare. That's what we've done. And then you look at the clinical team, the nurses and the doctors that are so desperate to provide compassionate care. How can they do that if they don't have the time? So we're in the business of creating time. We create time not only for our staff, but also for people. And we do that in a number of different ways. The general concept is if you're a doctor, you're the most expensive team member in the clinic. And so why are you using your time to do things like notes and administration? So we have a group of helpers called medical scribes who are essentially the assistants, the personal assistants to the clinicians. They do all of the notes, they do the correspondence, they do the referral letters, the medical certificates, they follow up results, they keep the doctor on track, they make sure that they're fueled with caffeine. And they generally just hold the whole show together, creating valuable time for the doctor, because the doctor's time is to make high-level decisions and to consult with the patient and make sure all their questions are answered. And then we upskill our nursing team. We get our nursing team to perform at the very top of their scope, providing them the best workplace satisfaction. So we train them to put sutures in wounds and to plaster fractures and those sorts of things. So tasks or procedures that traditionally would have been done by the doctor are now being done by the nurse, again, offloading the doctor, but also fulfilling the nurse. And to be honest, nurses are better at doing this stuff anyway because they really focus on the detail and they want to do a really good job. And so when we talk about creating time, we're actually creating quite a lot of time. In fact, most people are in and out of our clinic in less than 1 hour. And remember I said the median length of stay at our local hospital ED is greater than 5 hours. So on average, we're saving people 4 hours of their time. 4 hours. So now we have a model in community that provides better patient outcomes because you have senior decision makers making specialists making the decisions, better patient experience through hospitality and healthcare, in record time, and here's the clincher, at less than half the cost. Remember I said it costs government nearly $800 to see someone in an emergency department? Well, we're doing all of that for less than half that cost. Crazy, isn't it? And it's here now. It's here in our region now. And it's growing. There are already 5 of these clinics in New South Wales. And this will be the future of healthcare. And this will be a growing option to provide accessibility for every Australian. And so I'm pleased to say across our 2 clinics regionally, We've seen over 20,000 people since we opened 18 months ago. That's 20,000 people that otherwise would have attended an emergency department because they simply had nowhere else to go. And so while people come to us, what's happening in the emergency department is that there's less people going there, which means that all of those important resources, expensive resources, and the teams that are designed to attend to people with life-threatening injuries and illnesses are being directed to the people who need them most, to the real emergencies. And so we're helping and doing our bit to offset the healthcare system more broadly. And so what I'd like you to think about is the next time you have a kid that falls over and needs stitches, where are you going to go for help? Don't need to go to an emergency department anymore. There is an option in community for you, and you can avail of that today. And in the future, this option will be available for everyone all across Australia. We are revolutionizing how urgent medical care is delivered in Australia. Thank you.